So my journey in endoscopy started late because in the beginning I was not interested, but once I started getting interest, then there was no turning back. And I actually started loving this endoscopy. But friends, let me tell you, you got fantastic surgeons, you got the best of the skills, the best of equipment. But friends, what is it that we need to know? We need to know how to handle some problems. You may be a superb surgeon. You may be Amitabh Bachchan of endoscopy. You may be a Shah Rukh Khan of endoscopy. But you have to be a simple, calm thinking and a person who can actually manage the things when any problem happens with common sense. So friends, in spite of being very skillful, you have to be ready for some of the problems which can happen. Yes, OT mishaps, you may go and puncture something, you may go and cut something, you've got skills, you can suture, you can do everything. But then sometimes there are some things like mishaps which are beyond our understanding, something, which is beyond our control. So friends, that is where we actually need to be careful. I had passion to become a doctor to save lives. I had the knowledge, I had the skill. I used the latest technology. I put my life to save the others. Dear people, with love and care, you are doctors. But friends, all this is okay when we are talking among ourselves. But when there is an incident like a table death, how many people are going to remember that you were one of the most skilled doctors? You are one of the most wonderful human beings. That is the reason why you need to remember, friends. Yes, Hippocrates' oath, first do no harm, primum non nocere. This is a very nice statement. All of us definitely want to do our best. We do not want to cause any harm, but be ready to face it when you have a problem. A simple case, a woman was evaluated, diagnosed to have infertility and endometriosis stage 4, was posted for lap cystectomy, for radiolysis. This is a very simple case. I think in the middle of the night also I tell you all will come and open and do and go. But this case, trocar was introduced, patient went into a shock, and then they realized that the trocar was in the aorta. And by the time they got together doing everything, and in the process, there was a cardiac arrest and table death. Another case scenario, a 48-year-old woman had excessive irregular bleeding. Then she was found to have a huge fibroids, huge uterus. She was posted for lap hysterectomy, anesthesia was started. Then suddenly a woman started having low oxygen saturations, then tachycardia, hypotension, cardiac arrest. Resuscitation was tried, could not be revived. Now, what is it that you're going to do, friends? I am not a medical legal person, but I have seen many of my colleagues who did have these problems. And yes, to the best of my knowledge also, I've been able to help them to try to get the best from the medical legal experts. We have got fantastic medical legal experts. We have got people like Gitendra, we have got Manish, we have got my Jamuna, we have got Hitesh, so many people. You may have somebody whom we don't know in your place. But remember, you need a common sense. First, examine for 5 minutes. Death, you have to actually confirm the death, the A to E approach, airways and breathing, circulation, palpate for a pulse for more than 1 minute. Then check for the central pulses. Disability, check for the pupillary response. No response to the painful stimulus, the pupils will be fixed. Then the periphery is cold. ECG or cardiac monitor continuous asystole. Then you need to train your duty doctors on this by using OSCE stations. That is very, very important. You can't be in a dilemma. So your diagnosis of death has to be very, very clear and documented. There are very high chances of being accused on malpractice or negligence or criminal act by the doctors on the treatment when compared to other deaths in the hospital. So the onus is on the treating team, on you as a surgeon to prove or to rule out the cause of death for which there are likely to be allegations later on. What are you worried about? Ransacking of the hospital, assaulting the staff. Well, friends, at the same time, when the scare, you're worried about the police, the criminal law, the advocate, the civil law with appeal at multiple levels, then the district forums, the state, national, Supreme Court, and then our medical council. Of course, now the new body which has come, professional misconduct at the state level, national level, Human Rights Commission, High Court, professional death sentence. There are so many, you realize all this only when you are in trouble. And the icing on the cake is the media. Many people will love to be in the media, would like to be on the TV, would like to be on the newspapers for good reasons, but nobody would like to be on the scrolling news for the breaking news. Well, we have got fed up hearing the Sushant Singh Rajput's alleged murder, and today, of course, they say it is an suicide. But then, when it is a death, we don't want any such publicity because none of us have gone all out to do anything wrong. But most important, what you have to remember, keep yourself calm. You need to remember that you have to handle with care. Your presence of mind is needed. You may be the best of surgeon, but please forget your surgical skills. Keep your presence of mind and always have your people around you who will help you. You ask for help, Hare. Don't hesitate. You may think, what? I am Shantakumari, I am Sunita Tandalwarkar, I am Rishma Pai, Rishikesh Pai, Ashish, I am the best, or Prashant Mangeshkar. No, no, no. Please ask for help. Your colleagues will be in a stable mind. They will be able to give you advice better. And please follow no blame culture. Now, what is the cause of death? It could be an anesthesia related, it could be a patient related risk, procedure related risk also. Sometimes a medical error. But what matters is a doctor-patient relationship. We have not started the surgery to do a murder. It's an unfortunate incident which has happened. So how are you going to manage? There are three aspects: medical, social, and legal. Three compartments are not tight, but they're all intermixed with each other. They're all circles which are connected to each other. And you should know how to connect the dots. The most important, please don't panic. Death per se doesn't mean negligence. Just because the patient has died doesn't mean that you are negligent. Res ipsa loquita principle is not applied immediately. Always remember, you activate the code blue. The code blue members, you have the physicians, the intensivist, the anesthesia team, the cardiologist, then the pediatric attending if you are doing an obstetric case, or you have another OB-GYN or a senior resident, the nurse, ICU, emergency, unit nurse, respiratory therapist, security guard. This is how the code blue goes, and everybody knows, okay, there is something wrong. Second rule is resuscitation. Please don't panic and give up. Anesthesiologist has to lead. You don't become the anesthetist. Please let him do his job. Keep your emergency box in order in your OT, and it is your responsibility also to check it. Don't say, hey sister, I told you to check. Why you have not checked? Nobody will tell that it's a sister's job. They will tell it's your job. You are the surgeon. You are the owner of that OT for that patient. So you are responsible. So please take off of it. And protocols. Guidelines have to be in place. And remember, most of us usually have a pharmacy which will be attached, and we usually sometimes they'll write the prescribing drugs to get it. But remember, avoid prescribing life-saving drugs during the emergency, because retrospectively they say, Hare, the doctor did not even have that life-saving drug during emergency. If you want it, you use your staff or yourself get it, but don't ask the patient attender or anybody to get those life-saving drugs. For resuscitation, please function as a team. Let the people who are experienced in doing the job do the job. Do whatever indicated medically to revive the patient. Proper documentation is a must. There is no alternative to it. Treatment is not only to be done, but it must be seem to be done. You may be doing, but it has to be visible. It has to be recorded that it has been done. If you're doing everything in the background and not seen, then that is not going to help. 2 in 1. Most important rule number 3 is call for help. Please forget whoever you are, call your seniors, experienced person for help, guidance in different branches. That is why maintain your connections with the other specialties also in your area of practice. Never blame other members. See, we have got a tendency to blame the anesthetist. Please don't do that. Work as a team. And rush protocol, rapid ultrasound and shock and hypotension. Look for the pump, evaluation of the heart, the tank, you have to see the volume status of the IVC, the vascular system evaluation. All this has to go on simultaneously. And the other thing is, the idea is, okay, should we share now? Okay, something has happened. What do I do? What do I do? I'll shift off the patient. I'll shift to the ICU. If I don't have ICU, I'll go and put her in the other. So this Suresh Gupta versus Karim Abran, I used to wonder what it is. I asked Gitendra, what is this you always talk? And he has told me this. You have to remember that when you have a dead patient, by putting the patient in an ICU doesn't absolve you of your problem. So don't do desperate acts of shifting. You have to shift the patient justifiably. Communication is very important. Maintain good relationship with your staff. They are your most important people. Please be good to them. If they have trouble, you help them, so that when you are in trouble, they will help you. See, if you are going on shouting or being very brash or being very irresponsible or not reasonable, they will be waiting a chance. We have got a chance, so they will be waiting to settle scores. Please don't do that in your team. Now, everyone needs to know what happens. Otherwise, the IMA will go and tell something. The ward boy will go and tell his version. The security who is outside near the gate, he will tell his version. So better you actually tell them some in clear words what has happened, why it happened, so that they all talk the same language. And please set the OT and procedure room in order. You clean the bloodstain drapes, check the OT equipment, save used material, catheter in place, IV in place. Check whether the ET is in the esophagus. Then if you have opened the abdomen, please close the abdomen with the mop count. Don't forget to do the mop count because the patient is not there. Check expiry dates of all your medicines. And the most important is the communication. Communicating or breaking the bad news is the most sensitive and the most difficult thing. We need to be very empathetic. Communication of an intraoperative death is very vital. The sooner the people can be informed, the better in particular. Please don't be very irresponsible. Spike model, the 6-step protocol for delivering bad news. Maybe step 1, you set up an interview. Step 2 is assessing the perception, obtaining an invitation, call them down, giving knowledge and information of the patient, addressing the emotion with empathetic responses, and strategize and summarize. Be clear. You handle the reactions, emotions, pain, anger, guilt, and shock. I have to tell you something. There was about 15-20 years back, my friend, one of the senior obstetricians, she had come from a district, and she told there was a nursing home in one district where there used to be a lot of maternal mortality. But nothing ever happened to the doctor. You know why? Whenever there was an unfortunate situation, if anybody goes, there used to be one person who used to be howling and in a very bad state and managing and everybody used to be around her trying to even make her okay. Even the patients who have lost the attenders who have lost the patient. And that used to be that gynecologist of that hospital. She used to become very emotional and she used to be in more problem than the relatives. So that sort of an connect she had. So they never had any problem in that nursing home. Whether she was really emotionally or we don't know, but please be empathetic. And only 1 or 2 senior members to handle. Do not allow all and everybody to interact. Just tell them, each one of you do your job. You are not going to be my spokesperson. Do not say that you are in shock. Do not say I was wrong. Do not blame the attendants. Do not ask them to settle the pending bills. This is very, very important, because many times the patients know that the doctor has done, everything was done, but the bill is so high. So the attenders and all will be actually looking at, now is how do we get out without paying? So that is very, very vital. You may think I have done everything. Why should I? Please don't. Settling the bill is not the criteria. Please allow them to ask questions. Make arrangements for taking the body away. Don't say, I'm going to keep the body till you settle the bills. Communication, again, please have good connect with the general practitioner. And if possible, assist you in breaking the news. You have some social worker, somebody who has got a good reputation in the area to come and help you. And then please call the doctors. It's not easy. You have do's and don'ts while breaking the bad news. It's very important that you're sure about your facts. You have the conversation in a quiet place, and then you have the relatives, and don't allow the whole mob to come in. You ask the responsible 2-3 people of the patient attenders to come in at a time at the conversation. Use simple language. Avoid too much of technical information. Ask the relatives if they have any questions and try to answer them honestly and clearly. Only give information as and when required. Don't go out of your way and answer everything which is not relevant. Observe the reactions, and then see in the exam. I still remember my DNB exam after my MD. You know, I never used to like the pelvis, so so that examiner put a pelvis in my hand. I had to answer. So I was looking at the examiner's facial expression and started talking. So looking at the facial expression, I knew that I was going in the right track. So you have to follow those sort of things. Please do give the information in all stages. Don't go and break the news very, you have to, it starts from, yes, it is going to be bad, it is critical, yes, it is becoming bad, we are getting help, we are doing work. You create the scene and then break the news. Be very gentle. They may not absorb it fully at the very first minute, because sometimes it's an absolutely healthy patient who has walked in. Offer support, offer kind words and condolence, document the meeting and inform others about information. Please don't give bad news on telephone. Don't lie. Do not avoid seeing the patient in the shock. Don't leave the OT and run off. Do not collude with other families in lying to the other members. Don't be judgmental. Do not be definite about time. Don't lose your temper. They may scold you. They may try to this thing. Don't lose your temper. Don't leave the dead body alone. Don't waste your time in shifting. And then please don't succumb to the demands of the relatives for postponing a postmortem. Handle it very tactfully. So communication is very, very important. Friends, the office bearers of local association is very important. So be a member of your society, be a Foxy member, so that you have your members. I have 1,000+ members in my society. So at least in trouble, think at least 10 people will come. So most important is to have a good connection with 4 or 5 people. Proper documentation, there's no excuse for it. Document, check, case record, intraoperative notes, anesthesia notes, resuscitation, consultation notes must tally among consultants. Proper documentation, make sure that everything is there, and don't try to damage it. Please don't alter the existing records. You can add something. Sometimes you want to write it in the end and just you write it, but don't mess up what you have written in the earlier, and put date and time, very important.
Ma'am, sorry to interrupt, 2 minutes left.
Yeah, documentation is so important. Then friends, remember, if they may ask you, somebody will come and demand the case sheet. You be a patient, give them a Xerox. You need not give them the original. Death certificate is very mandatory by police law. Postmortem, please insist on postmortem. Very, very vital. Legal management. That's why you have all your all the legal experts, friends in hold. Build a support system. You need your team. So conduct the inquiry closer to the incident. So friends, please update your knowledge along with your skills, and CMEs, please improve your conversation skills with the patient. Do protocols checklist. Have all your code blues. Good documentation. Always respect, love, and care. So friends, surgeons are not doctors, but real lifesavers with good skills, knowledge, compassion, but only they can teach how to live life. But friends, remember, when you have a problem, please think, and definitely you will be able to handle the issue. Thank you very much.